This child has acute diarrhea. If not rehydrated immediately, he will die. Fortunately, health research conducted in Bangladesh has ensured that he and millions like him can be saved. These children are the future of our planet. Ensuring better health for them ensures a better future for the world. Poor health and child mortality are also related to the growing problem of overpopulation. Parents in developing countries see as many as 1 in 4 children dying before the age of 5, and therefore have extra children to compensate. To maintain the successes that population research has had in reducing population growth, health research and health programs are essential. The World Bank noted in its 1993 World Development Report that investments in health research and development have yielded high returns in better health. Recognizing this, over 30 donors support the work of a unique international health and population research organization, the International Center for Diarrheal Disease Research, Bangladesh. Bangladesh has a population of nearly 120 million, and its population density of over 800 people per square kilometre is one of the highest anywhere in the world. Overcrowding, poverty and poor access to health services means that infectious diseases and malnutrition are common. Infant and maternal mortality remain extremely high. Working in this setting, ICDDRB is able to carry out large-scale research on health and population issues common to the developing world.
ICDDRB, also known as the Center, was established as an international non-profit health and research training institute with a mandate to address diarrheal diseases and the related problems of nutrition and fertility. The center has built on the work of the Cholera Research Laboratory, which was established in 1960 and was recognized as the leading international health research center located in a developing country. ICDDRB maintains that reputation, and today the center's work is often cited as the authority for important health and population-related decisions taken by multilateral government and development agencies throughout the world. Indeed, many of the center's alumni are influential policymakers in these agencies.
In 1968, the first clinical trials of oral rehydration solution, or ORS, were completed at the Cholera Research Laboratory. It was a breakthrough hailed by the prestigious British medical journal Lancet as potentially the most important medical advance of this century. ORS has been estimated to be saving the lives of over 1 million children annually.
Of the 12.5 million children that die each year, we still have the lives of 2 million of them. At least 2 million of them could be saved if all families would use oral rehydration therapy, which is now currently saving the lives of 1 million.
Adoption of the ORS technology could save as much as $500 million a year in the United States of America and 10 to 15 billion worldwide. Similarly, the research which demonstrated that the old injectable cholera vaccine gave extremely limited protection has saved the world billions of dollars after WHO stopped recommending it for all travelers. In 1993, a new strain of cholera, Vibrio cholera 0139, emerged. This strain is now spreading rapidly through Asia and is likely to cause a new global pandemic. The characterization of this new and emerging pathogen and the disease it caused was completed within a few weeks of its discovery by the scientists working at the center. Through this coordinated multidisciplinary effort, the world was warned of this new infectious agent, allowing preventive measures to be taken in anticipation of its spread.
On examination, we had a
The centre's two hospitals provide an effective mechanism for the study of cholera and other diarrheal diseases endemic in Bangladesh. The hospitals, backed by the laboratories, have allowed rapid completion of research on diagnostic techniques and specific nutritional and pharmaceutical interventions. The laboratories were developed to study health problems commonly encountered in the developing countries using the most sophisticated modern equipment available. They bring together a critical mass of experienced experts in bacteriology, virology, parasitology, molecular biology, immunology, bacterial genetics, histopathology, nutrition, biochemistry, and environmental microbiology. To allow the rapid compilation of data collected by ICDDRB researchers, the centre is equipped with advanced computer systems. The centre's library data archives and publication facilities provide additional support by ensuring the quick and effective exchange and dissemination of information. The centre also has new training facilities, including a 192-seat auditorium and two large seminar rooms equipped with the latest audio-visual equipment. The centre's extensive rural and urban community health service delivery systems, together with its excellent working relationships with the government of Bangladesh and non-governmental organisations operating in Bangladesh, provide exciting opportunities for social, behavioural and operations research in a wide variety of settings.
ICDDRB's MATLAB field station is routinely described by international health and population research experts as outstanding, unique, inspiring. MATLAB and the surveillance system operating there offer extraordinary opportunities to conduct health and population research, which is not just national, but also international in its implications. There are two surveillance systems in operation, the record-keeping system and the demographic surveillance system. The record-keeping system, the RKS, contains critical information on health status and health service delivery in the MATLAB intervention area. It includes information on mother's reproduction, contraception, immunization, and breastfeeding status since 1977, and children's morbidity, arm circumference, and immunization status since 1986. The Demographic Surveillance System, DSS, has collected the most comprehensive longitudinal demographic data set in the world, and, together with the RKS, offers an unparalleled quantity and quality of data for development planning and health intervention research.
In 1977, Maternal and Child Health and Family Planning, MCHFP, work began in MATLAB. The project was soon able to provide solid evidence that economic and social development is not a prerequisite for fertility reduction if contraceptive services can be introduced and sustained in a culturally appropriate manner. The programme's success prompted the government of Bangladesh to request ICDDRB's assistance in developing an effective nationwide MCHFP service. The centre's MCHFP extension project takes many of the components of the MATLAB MCHFP project and adapts them for wider implementation through the government system. Today, almost half of eligible couples are using some form of contraception, and Bangladesh is being cited throughout the world as a family planning success story. Similar extension efforts are underway in the Urban Health Extension Project, which is working in collaboration with government and non-government agencies to take the centre's research findings and implement them in crowded slums of the capital. Similarly, ICDDRB researchers are working with UNICEF and other agencies to improve water and sanitation, personal hygiene practices and nutrition. ICDDRB continues to examine the scheduling and delivery of vaccinations, work that has significant implications for developed and developing countries alike.
ICDDRB's new strategic plan envisages continuing work in 3 key strategic areas where the Center sees the principal challenges to the year 2000. The first is child survival. Diarrhea, acute respiratory infection, and the 6 immunization-preventable diseases still account for 2/3 of child mortality in developing countries. The Center will continue to spearhead the fight against these diseases. The second is population and women's reproductive health. Given current trends in population growth and maternal mortality, family planning and reproductive health must and will remain at the top of the world's agenda for many years to come. The third is to continue operations research for the effective application of existing technologies and to assist in policy formulation. ICDDRB recognizes and has given priority to the need to translate research findings into action.
ICDDRB is an organization with a long history of outstanding success and achievement. That success belongs as much to those who have helped to sustain the center as it does to those working there. ICDDRB is a cooperative effort. As the Centre prepares to face the global health and population challenges of the coming years, it calls upon your support. With the cooperation of all concerned, ICDDRB can continue to maintain its standards of excellence and to bring improved health for everyone, thus ensuring a better future for the world.